the vertebral column. It is important. Everything is important. I think I should stop saying this. Now Valentine's Day had just passed out. Again, bashi, stale. Now, when I was in Bhubaneswar, it was just prior to Valentine's Day, supplement was given in the newspaper. I liked it and I put it in my PowerPoint. See, he's dancing, the two skeleton, a female and a male skeleton is dancing salsa. Okay. And this is I put in because you see our spine, our vertebral column, our everything is in such motion, and also it can be flexible. He goes to the gym naturally. Now, I support. Don't. Your physical activities, mental activities must be there. If you like dancing, you can go for dance. Okay. Now we'll just see. Now, evolution of erect posture. I told you earlier that we were quadrupeds. If you go to Darwin's theory or the total evolution, you can see the brain size. The brain size, and this is the Homo sapiens on that. Now, line of gravity passes through the head, it goes the body of the axis, and then it passes like this. The sternum is in front, and the sacral promontory, the head of and neck of the femur, it goes behind and into the condyle of the femur, and in front of the knee, in front of the ankle. Now, if there is any deviation, you will have your deformity of the spine. It can be kyphosis, it can be scoliosis. Now, the vertebral column keywords, parts of the typical vertebra and their function, body, vertebral arch, ossification and processes. Now, parts of the vertebra from above, you can see this is the transverse articular process, the thoracic vertebra, spinous process, vertebral arch and the body. Now, typical vertebra from side, you can see from the side, because see, you'll be encountering, I just give you a talk on this, because you'll be encountering, you have encountered the thoracic vertebra, now you'll be encountering your lumbar vertebra. And also, when you go to the head and neck, it will be on your cervical vertebra. Bony parts of the vertebra at birth. Now, composition of intervertebral foramen, you can see the pedicle, nerve and articular process, the disc and the body. Now, proportion of bone to disc in presacral parts of the vertebral column by Todd's data. You need not study this Todd's data for postgraduate. Now, this is similar. Now, vertebral foramen of T6 not larger than the ring finger actually, this ring finger. If you put in your finger, the vertebra, that is the vertebral foramen of T6, thoracic 6. Now, compression of spinal nerves. This is an MRI. You can see the vertebral column over there, the arrows. It is being compressed. Again, laminectomy of spinal stenosis. This is an MRI for the spinal stenosis. Now, you can see lumbar puncture, spinal tap. Now, see spinal needles. Spinal needles are there. For the spinal tap is a very common thing, procedure you have to perform. You have to learn to perform. Because when you are in the ward rounds, if a patient admitted with meningitis or encephalitis, then you take the cerebrospinal fluid and send it for microbiological and pathological estimation and biochemical. And also, the lumbar puncture spinal tap, you see needles are very thin, and nowadays, modern times, previously it was very thick. And not disposable. You in our days we didn't have these type of needles, so we to do lumbar puncture with those that has to be sterilized, or you can reuse. You have to know a bit of the evolution of instruments and all, just for casual reading. And then this is for use for epidural anesthesia. Okay, just above the spinal anesthesia we use it. We don't the terminology we are using or spinal anesthesia. Okay, now it will be epidural anesthesia. See, sometimes what happens when you're pricking, you injure some small vessel or the muscle, you go into it, and then some blood comes. And when you take out, if blood is coming, then you have to change position of the needle. Now see, coccydyna. This is the coccyx, pain in the coccyx. You sometimes have an injury, or sometimes it's all of a sudden you get a pain in the coccyx, and that is known as coccydyna. You have to reassure the patient and tell her to use a soft pillow. These pillows are available now. Huh? And now cervical spine immobilization. See, this is the cervical spine and this is the implant. Now, caudal anesthesia, the caudal in this part. For small procedures of the anorectal region or like piles, fistula, fissures, you have to give an anesthesia, saddle block. It doesn't stay long. Like a spinal anesthesia, it can go for 2 hours for this cholecystectomy operations or any orthopedics operation, small procedures. Okay. Now, vertebral venous plexus, batten valvulus plexus. This you will come across in your head and neck. Now, you see fracture vertebral body. This is the fracture. Ashun. Huh? I don't ask for explanation for anyone. তুমি পড়ছো কি পড়ছো না, তুমি প্রেম করছো কি করছো না, এই আমার বিষয় নয়। এসছো দেরিতে ঠিক আছে। What you are late for some reason or the other. তুই দেরিতে আসিস, you ask again. I'm there. Teachers will be there, but don't kill yourself. Don't kill yourself because coming to study medicine, you are killing yourself. Don't. Now see, this is a fracture here. Now, spondylolisthesis L5. Now, spinal dyspareunism, cauda, equina, and sinus here. Scoliosis. This is the common disorder of it can be pathological, mostly pathological, and common is your tuberculosis. Now, this is congenital spinal malformation. This is congenital spinal malformation. Now, flexion and rotation injury. See, this is the type of injury, the flexion and rotation injury of the vertebra. Crush injury. See, this is of the two vertebrae. This is the two vertebrae. And you see, if you fall in this pattern, because any emergency, any patient comes to you, কি করে পড়ে গেলে? স্যার তাল গাছ থেকে পড়ে গেছে, খেজুর গাছ থেকে পড়ে গেছে, কিছু লফট থেকে জিনিসপত্র থাকে, ফ্ল্যাটে সব লফট আছে। So be careful. Don't like on online and Amazon, you see nice ladders, foldable, flexible. You order for your mom. Don't. And because she might fall and kill herself. Now, flexion injury, see, this is how a person falls. It can be during games or anything. See the pattern of injuries. Now, extension injury, head-on collision, night drive, chance fracture. See, it's in the Airlines, fasten your belt, seat belt, the air hostess comes and she does some, this thing shows you, and you are, but you please fasten your seat belt when you are going home. Please pay attention. Today we will be discussing the liver. If there are 150 students, 75 will be asked. ঠিক আছে, আমি একটা র্যান্ডম বলে দিলাম কিন্তু এটা 75 students will be asked. And what you have to do is that you have to identify. You cannot make a mistake because it is one of the largest organ of the abdominal cavity. The measurement and your weight is around 160 grams, and in the male and in the female 103 grams. Everything seems to be smaller size in the female, but they are enduring maximum stress and strain, and they are more stronger than men, but they are weak in their mindset. It had a quiz. The next day we will discuss on 5 minutes on this topic. Okay? See, I just I can't understand the psychology of this. Man is having a relation with a woman, can be a married couple, can be anyone, but there is in some place that the woman is helpless or depends on the man. এটা তুমি ভাববে, তোমরা অনেক কিছু ভাবো, এর মধ্যে একটা কোয়েশ্চেন দিয়ে দিলাম। Okay, now you see, explain the anatomical basis of liver biopsy, site of needle puncture, obstructive jaundice. Describe and identify the microanatomical features of gastrointestinal system, liver. Describe the development and congenital anomalies of the foregut, midgut and hindgut. This chapter includes gross anatomy, histology and development of the liver. Now see, I'm telling you your features that I told you in the discussing the abdominal aorta. Now, when you are studying liver, you see the location, the size, this much. It is having some lobes, the relations of the anterior surface, your posterior surface, lateral surface, and the superior surface and the inferior surface. Now, the dead body is lying like this. Or you are in the operation for gallbladder or hepatobiliary system, then the patient is in supine position like this, under anesthesia. You open, you see any procedure, you make a right paramedian incision. You open up. Sometimes you need to explore or some problem is there or some anastomotic operations or some cancer operation, then you have to open up. Now, what you will encounter is that, now see the other day I described the planes and lines of the abdomen. Now, liver is the largest gland of the body. It is the second largest single organ after skin. Now skin is an organ. Do you agree? Okay. Now skin is an organ, so you can transplant skin graft, and see, liver consists of exocrine part that secretes bile through the biliary passages, endocrine part that liberates chemicals directly into the blood. These chemicals include glucose, heparin, plasma proteins, except immunoglobulins, except immunoglobulins, cholesterol and so on. Size, shape and color of the liver. Now, the microscopic anatomy, histology. 4 days exam, either you get kidney or liver or alternate at least 2 days or 3 days there will be a deputation. Or first day you get liver or on the last day liver. And I told you 15 marks ke liye target karo. That's histology and your gross anatomy. Okay. Now, size, shape and color of the liver, dimension, weight in adult male is 1600 grams, 1600 grams and 1300 grams in adult female. Weight of liver at birth is 150 grams. The weight of the liver is 150 grams. And also, see liver at birth, you can see it. With the respiration of the child, this will move and come. And the mother will say, "Doctor, এটা কিরকম নড়ছে? এটা দেখুন তো." না না ওটা ঠিক আছে। But you have to see, medical practice is all acting. অভিনয়ের একটা ভালো জায়গা আছে। Now, what I want to say is that now shape, the liver is wedge-shaped. The liver is wedge-shaped organ with broad base directed to the right. It is 4-sided pyramidal structure. It's a 4-private pyramidal structure. Color, it's reddish-brown in color, solid and friable in touch. It is, even if it is foreignized, but if you can break it. Friable means if you get just with a bit trauma or you put some finger, you see it breaks. Even you have to be very careful when you are assisting. First, you now become an assistant. Now, when you are assisting your boss for open cholecystectomy or some open surgeries of the liver, then you have to be very careful retracting and this thing because it's very soft. When you go to take purchase mutton, so एक तो liver, 5 kg goat, one small liver is 250 grams of a goat I'm saying. Now everyone wants to take a piece of liver. Then how the guy manages, I don't know. Anyway, it is friable. I want to stress it is friable and liver occupies the liver occupies whole of the right hypochondrium, greater part of the epigastrium and extends into the left hypochondrium up to the left lateral mid-clavicular line. See here. See here. The mid-clavicular line left and this is it is hypochondrium, right hypochondrium and you can see this part up to this part. And there is you can, if it is enlarged due to any pathological condition, then you can palpate. You palpate from the right iliac fossa, you go like this, like this, like this, like this. Ask the patient to respire, and then you can see it's coming down and up. If it is enlarged, 2 fingers enlarged, or one finger enlarged, or 3 fingers enlarged, you put a note. Okay. Ultrasound to milega hi. आपका CT scan you will get it, but with your clinical knowledge and see the spleen is in the left hypochondrium. The spleen is in the left hypochondrium. Now this you palpate like this, like this, like this. From below you go up, and to palpate a spleen, you will be seeing it. You will be seeing it like this. It's moving up and down with the respiration. It's moving up. Coming down and coming up. Spleen, even the liver, you can see the border. And one thing I want to say that you have to palpate from right iliac fossa to upwards in this pattern. This up to here like this. You go in this and but liver you go and palpate like this. Got it? Now Liver occupies the whole of the hypochondrium, greater part of the epigastrium. This is the epigastrium. It extends into the left hypochondrium up to the left lateral midclavicular line. It lies mostly under cover of the ribs and costal cartilage immediately below the diaphragm. It extends under the rib cage higher up to the fifth rib, anteriorly on the right side below the nipple, and in the left fifth intercostal space, anteriorly on the left side, it is below and medial to the left nipple. In the middle line, the upper border lies in the level of the zipisternum. Here this is the upper border. Here, zipisternum and zipisternal joint. The sharp inferior border crosses the midline at level of transpyloric plane. This is transpyloric plane at the level of L1. These are normal. Anything goes down, liver enlargement, or it can be in any hepatitis. But in cirrhotic livers, it might be getting with a long duration of cirrhosis. Then there is a small liver with multiple fibrosis, small dot like. We in this first dead body which came to our college, that body was dissected, and that liver we have placed it in your pathology. But the man was like this, but the liver was so small due to pathological condition. That is placed in your pathology. When you go, you please see it. Okay. Now, some interesting facts. The proportional weight of the liver is more in children, 1/8 of the body of the weight, than in adults, 1/36 of the body of the weight. This is because of the hemopoietic function of the liver in fetal life. Then it is boro lage. According to the baby's weight, and the liver is called hepar in Greek. Hence, many structures related to the liver are termed hepatic, hepa and hepatic. Now see the external features following. Now see the superior surface. This type of drawing diagram you do. Of course, right lateral, left liver draw करने का कोई तकलीफ ही नहीं है. You see. In prescription, I always draw some type of this illustration. I put gallbladder, there's a stone, or if there is the stone, if it is CVD stone, then CVD stone. And now 5 surfaces: anterior, posterior, superior, inferior. Right. When you ask to hold the liver, you hold it. Calm down. Superior surface. You see the wedge like this. The superior surface, you feel it. Then, right, inferior surface. Like this, you go to the descriptive part. Quadrate lobe, don't go. First, you just describe the practical part of it is this. And under surface. Now, when you are holding it, then you start, if you are, you have read it, you start describing the undersurface. Because you have many things to answer on the inferior surface. Now anteriorly placed, you imagine this, the previous picture I showed you. There's anterior, posterior, superior, inferior, and right. And the left lobe is, see, wedge shaped, it's thin. Okay. Now, anatomical lobes, the anatomical lobes are right lobe, here the right lobe, here the right lobe, and the left lobe, this is the left lobe. Now, you see the caudate lobe and quadrate lobe that will come. Now, factors keeping the liver in position. 4 marks question. Or you will be asked when you are holding the liver, okay, this organ is very heavy, how it is kept in position, how it is in position. Then you think of the structures we told you, that hepatic veins, major factor that open into the inferior vena cava. Intra-abdominal pressure, ligaments of the liver less important. Liver is essential for life. Even surgical removal of 2/3 of the liver is compatible with life. If hepatectomy is done, removal of the liver due to some pathological condition, then it is compatible. Of course, there are portions, there is a big cyst, and very common in our country is a hydatid cyst. It comes from tapeworms, worms infestation. So, in this practically, I had an opportunity to open up at least small size and this thing, your hydatid cyst. Now you have to be very careful because the fluid in the cyst, if its spillage is there, then patient can go into shock. Okay. Now one thing is this, that you can do it in very good in our Santiniketan OT, you can do it. And but nowadays there are harmonic knives. You cut through, the minimum bleeding is there. Through any tissue, organs and all, if you cut through, it will do. Harmonic knives, okay. Now you can, now see again, it's a repetition, hold the, now hold the anatomical position, hold the liver in such a way that groove for the inferior vena cava on the posterior surface of the liver should be vertically straight. Okay, broad base of wedge-shaped liver is on the right, smooth convex-convex surface faces upwards, and surface of the liver has 5 surfaces: anterior, posterior, superior, inferior, right. Inferior surface is well defined and called visceral surface. That I told you, visceral surface. All other surfaces are ill-defined and continuous with each other, hence they are together called parietal surface of the liver. Now, in case they give you a short note, describe the parietal surface of the liver. Matha theke tai korbe na, bhabbe. Now, parietes. Parietal surface means from the parietes, external surface. Okay. Now, superior surface is quadrilateral. It is convex on the right and left with middle concavity as cardiac impression. Okay. Now, superior surface is separated by the diaphragm from lungs, heart, and now superior surface is separated by diaphragm from lungs, heart, and pericardium. See, the superior surface is separated by the diaphragm. Now, above the diaphragm, the thoracic cavity, what are the organs resting on the diaphragm? Okay. Then it is the superior surface, the lungs, heart, and pericardium. Anterior surface of the liver is triangular. It is divided into anatomical right and lobes of the attachment of the falciform ligament. I'll show you. And the anterior surface is related to the following structures: diaphragm, 6th to 10th ribs on the right side, 6th to 10th ribs on the right side, lower margins of the right lung and pleura, and 7th and 8th left costal cartilages and xiphoid process. Yeah. Now, see, this is the ligament with the fibrous appendix in the left and this is the falciform ligament, the inferior border. See, notch for the ligamentum teres hepatis. This is a lot. The ligamentum teres hepatis, yeah. And see cystic notch, yeah. Fundus of the gallbladder. Now, you have to practice the practice figure. See, this simple, these type of drawings. No shading, no coloring, ekdom na. तीन चारटे pencil, color pencil লাগবে আর highlighter pen রাখবে সেখানে importance গুলো. This falciform ligament is in circles. This will come to the anterior abdominal wall, it gets attached. Now, see, these terms you will be coming across. The bare, write a short note on the bare area of the posterior surface is triangular in the middle. It is deeply concave in the vertebral column. It shows the following features. Bare area, it is the part of the posterior surface of the liver that comes in direct contact with the diaphragm. Boundaries of the bare area is triangular. It has the following boundaries: apex, right triangular ligament; base, groove for the inferior vena cava; upper limit, superior layer of coronary ligament; lower limit, inferior layer of coronary ligament. Groove for the inferior vena cava, it lodges the upper part of the inferior vena cava. The floor of the groove of the inferior vena cava is pierced by hepatic veins. This is important. Now, this is a bare area. If you are answering very well, you will be asked. You will be asked, Vector Nama, a pant, Levi's and Wrangler jeans shown. The American people, they wear it on 1st December. And next January, they open. More dirt, more holes, and if there is no holes are there, Levi's and Wrangler jeans are dyed and everything put in this thing. They take guns and they make fire into this. So there will be holes here. And fading is guaranteed. Okay. Now, now boundaries of the bare area, right triangular ligament, groove for the inferior vena cava, superior layer of coronary ligament, lower limit, inferior layer of coronary ligament. Groove for the inferior vena cava, it lodges the upper part of the inferior vena cava. The floor of the groove for the inferior vena cava is pierced by hepatic veins. You will see it. And the left triangular ligament, this is the superior layer of coronary ligament. This is superior layer of coronary ligament. This is the bare area. And you can see the caudate lobe. This is the caudate lobe. And this is the quadrate lobe. In the gallbladder fossa here, and see the gallbladder. This is the quadrate lobe. Quadrate lobe. And this is caudate lobe. This is quadrate lobe. Hepatic artery, common bile duct, portal vein. Now, falciform ligament, fissure for ligamentum teres hepatis, there. Fissure for ligamentum venosum, this is here. Now, caudate lobe, caudate process, this is caudate process, papillary process, inferior layer of coronary ligament, right triangular ligament, gallbladder. This and the bare area you have to know, and the area and impression of different viscera. Yeah. Now see again, this is a repetition of the practice figure. See, this is the bare area. Fissure for ligamentum venosum, ligamentum teres hepatis. This is the gallbladder. This is porta hepatis. Quadrate lobe. This is caudate lobe. Right triangular ligament. Inferior layer of coronary ligament. Gallbladder. Now, caudate lobe. Now, it is also called Spiegel's lobe. It is situated in the posterior surface of the liver. Boundaries, the caudate lobe of liver is bounded by follows. On right, inferior vena cava; on left, fissure for the ligamentum venosum, superiorly continues with the superior surface, inferiorly porta hepatis. Caudate lobe is connected with the right lobe of liver by caudate process. Papillary process below to the left caudate lobe presents a small rounded elevation called papillary process. Relation: anterior superior attachment of lesser omentum. Posteriorly, it is related to the superior recess of lesser sac, right cross of diaphragm, aortic opening, and right training artery. Fissure for ligamentum venosum. It is a deep fissure that lies between the caudate lobe and the left lobe of the liver. Content: ligamentum venosum and layers of the lesser omentum. When the abdomen will be open in a thing, you will be these foramen and lesser sac, greater sac, you will be taught. Okay. Some interesting facts. Fissure for ligamentum venosum has anterior and posterior walls and floor. These walls are covered by peritoneum. The floor of the fissure contains ligamentum venosum, which is the remnant of ductus venosus. Ductus venosus. In fetal life, the ductus venosus connects left branch of the portal vein with inferior vena cava and shunts the blood from left umbilical vein to inferior vena cava, bypassing the liver. Groove for esophagus. Now, it is a shallow vertical groove, esophageal impression. The right surface is smooth, convex and covered by peritoneum. Relations of the right lobe of the liver as follows. The right surface of the liver is related to the diaphragm, 7th to 11th ribs. The lung, pleura and costodiaphragmatic recess intervene between the diaphragm and the ribs on the right side. Upper part of the right lobe is related to lungs and pleura up to 8th rib. Mid-axillary line, costodiaphragmatic recess. This is even costodiaphragmatic recess up to 10th rib, whereas the lower part is related to the diaphragm alone. Inferior or visceral surface. The inferior surface is directed downwards, backwards and to the left. It is separated from anterior and right surface of the sharp inferior borders. See here, the inferior vena cava, posteriorly. And you can see the porta hepatis. This is the gallbladder. This is the gallbladder. This is the gallbladder. This is porta hepatis. And this is the your caudate lobe. And this is the quadrate lobe. This is the quadrate lobe. This is the gallbladder here, the gallbladder fossa, and this is ligamentum teres hepatis. See, it is like this. Now, when you open, even if you you want to operate on the gallbladder. Now, you make a subcostal incision like this. Subcostal, below the costal line. Okay. Now, if you make an incision like this, you can see the ligamentum teres. It is fixed in the anterior abdominal wall like this. It is cord-like. Okay. So, see, I told you the rounded, larger lobe is on the right side. You hold it like this. Hold it in anatomical position. The smooth surface is on the anterior. So don't just see emni kore dekhte hi thakle, ultate thakle, emni korte thakle. बर्बाद. हम लोग बर्बाद नहीं बोलेंगे. Examiners won't say बर्बाद हो गया तुम्हारा. चुप रहेगा वो. Now, first part is this, that the anterior surface has smooth surface and the posterior things are that the vena cava and the related structures. The quadrate lobe is the this is the quadrate lobe. This is the caudate lobe and this is the gallbladder and the ligaments, falciform ligament and your you please see and study. There are 3 livers I've given here. Please see, and just main thing is that you have to hold it in anatomical position. If he's there or you're there, you will start. You saw the pattern how we are taking the examination. So you did not, but you keep open your ears, because by the time he finishes, I will ask her to hold it. This was the pattern in the examination. Am I correct? So accordingly, you have to mean microstructures and this. No, you have to go for the, if you are the first attempt you are blundered, then what will I ask? I won't be there in the examination hall, but I will be in the hall. But what to ask? My examiner will tell you. He'll be asking you. Chalo, chalo, now, ek kore, dhoro, 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 dhoro. Hey, dhor re. Now hold it, hold it, hold it, hold it, hold it. Pick up, pick up, pick up. Glove. See, they dhor. Now you want to be, you are, you know, you are, how many of you cook? Cook. Without gloves or without this thing? Without gloves. But who washes the dishes? Your mom?
When I cook, when I work.
Huh? You. Then for washing the dish, then you get kitchen gloves. That you can reuse. It is a big, it's not very comfortable. Means in the